I have a patient here of Bao.
Yeah.
Do you guys see the photo?
Yes.
Okay, so I'm going to try to move him a little bit into the center, and let me see if I can.
Yeah, I know.
So here in this particular scenario, I feel, let me just see if I can make this a tiny bit bigger. I feel that this patient has not had much improvement yet. So just as a background, the patient had so far 2 fractionated radiofrequency treatments. The second one was combined with CO2 laser. And in fact, I would even like it better. And the CO2 laser was a cool peer. In fact, I would like it better if I could turn the pictures around. Then I might say, okay, maybe there's a little bit of improvement. But the way it stands as today is I see either no improvement, or I could even potentially talk myself a little bit into I feel like it's worsened. Again, this is the photograph after 2 Infinity treatments that were carried out at 3.5 millimeter for the first pass to the cheeks, then 2.5 millimeter, and then 2 and 1.75 millimeter respectively for the last pass. And again, I am underwhelmed with results. I think Bao was also underwhelmed with results. So she reached out and asked, what can we do to overcome the limitations here? And I think
I thought I actually saw improvement. It just doesn't show well in this picture. The forehead shows really nice improvement. I inherited him from Kristen. The second time was when he saw me when I added the cool Keo. It wasn't much with this, but I feel like with this picture and then compared to the one before when I actually had him pull his hair back, the forehead I felt like was nice improvements, if anything, and he felt like he also felt like texture different. I just feel like sometimes is hard, but in this scenario, I felt like I see improvements with him. I'm not sure.
Yeah.
Well, at least they definitely for the forehead, I felt like I saw a difference. Because the picture left was the initial one before he had the Infinity with Kristen, right? And then there was like
the one on the left is the initial picture, the baseline photograph, before he had his first ever treatment. I can bring up the sideways photos. And the sideways photos I thought were also a little, where I felt like in the rolling scars on the cheeks, not much has happened. Let me just go to this one. And this one.
How many months has it been, Dr. Engfeld?
I think about 4 months since the second treatment. Wow, correct me if I'm wrong. It was in the summertime, right? And something like that.
That one done in August. The first one was in August, and then the second one was in November. So it's been about.
Okay. All right. And you see what I'm seeing here is much more reflection on the right-hand side versus much lesser in reflection on the left-hand side. And this is also what prompted me to specifically go to take a look what happened with the front photos, because I feel that there was a little bit more kind of, shall I say it, like, I feel like there's more of a hill and valley formation in the second photo, which was that's the November photograph, right? So it's actually after just one fractionated radiofrequency treatment that we're seeing right now. We don't actually see the results yet after let me just double check. You didn't take photos just recently, did you?
And he was the one in the blue shirt was when he was in January. And then the one at the bottom was the second time I saw him post. That's when I had him pull his hairs back, because in all the pictures, when I actually took the pictures, I had moved the hairs up, but I think the other one.
Right. They were not, right? So let's take a look again what happened like in between. So this is this one. This is in November before the second treatment, and then let's see what's going on in between.
Can I make one just little observation picture-wise and not to nitpick? I
Yeah.
feel like picture when he has the camouflage shirt on, it
Yeah.
doesn't, it's in focus. So it seems to me like it has almost like an airbrushed look to it. Do you understand what I'm saying?
It's
And I'm
not
wondering
as high resolution as the others. That's what you're saying.
what Val's saying, like it's not translating the improvement. Because I 100% agree when you're looking at the photos, that first one, you're like, oh my gosh, we've performed these great miracles. And then the more I'm looking, I'm like, I think it's just fuzzy.
That's what I was trying to do yesterday. It takes so much time looking at these pictures. I was trying to do the 3 like you're doing now, but I couldn't find anything. And I feel like what Channing was saying, it didn't really show. But then when I compared the picture from the blue shirt, both time where he had his hair pulled up was where I felt like I see improvements. Definitely on the forehead. from what I
Yes,
heard.
I agree absolutely on the forehead. You see this area here on the right upper forehead is much subdued. It's very difficult because we can't see it on the before photographs at all because there's no reveal to those. But I think there is very, very nice improvement on the forehead. No question about that. I'm just underwhelmed on the photographs on the cheeks. And in fact, now that we're seeing, a little bit more detail, we can actually say that after the first Infinity treatment, although this photo might look a little bit airbrushed, there is kind of, again, a bit more unrest going on the cheek area. So the question is, why are we creating this kind of unrest in the cheek area? And are there ways of how we can overcome it? So I think what I would, looking at the settings, again, it was 3.5, 2.5, and then either 2 or 1.75 millimeter. I think what I would like to eliminate is the treatment in the higher areas, not on the surface of the skin, not the CO2 on the surface of the skin, which can give some textural improvement. But what I would like to eliminate is the 2 millimeter versus 1.75 millimeter at the surface. And I would actually like to see him being treated only with the deep sections. The deep sections meaning, probably the first pass at 3.5, the next pass at 3.25, the third pass at 3, maybe even on the cheeks, a fourth pass with 2.75. But I would stay deep mostly so that we can free up in the depth those rolling scars without having to treat very much on the surface of the skin, and then to judge a difference. And I think on the surface of the skin, I'm not really 100% sure how much a CO2 laser treatment will do, but I would say it's not a bad idea, and I think it can certainly help to also increase the feel of the skin, the texture on the surface of the skin. And the cool peel settings were with 6 watt at that point of time. I think he can probably tolerate 8 watt as a cool peel setting. And I think that would overall help the forehead, the temples, and the cheeks. I would leave the settings for the fractionated radio frequency the same on the forehead as they were before. I would not change the settings there because we have, we see very significant improvement in that area. I just feel that the cheeks are not where I want them to be overall. Even, I think there is probably a little bit of improvement between the middle photograph and then the last photograph on the right-hand side, but I think it's not really I want it to be.
Can we do maybe like front? I don't know why I felt like I saw a little bit on the outer cheeks, maybe like the front view. I had to like zoom in and literally look at each scar.
Yeah.
It's so a lot, but I wonder if can you see it sometimes better? Because sometimes the angle here is so nice because there's a number, they just go directly in the center. It's really, really hard to get them in the right 45 angle every single time.
I know.
Did it?
It
But
is.
photo, it's small, it's a lot. They're always like, a lot of awkwardness.
Yes.
But I do, radio frequency, I do like to continue with them because of Bowen's scars.
Now, the other possibility, if there was more improvement in the depths, I would say the other possibility, I don't know if I saved this one. I hope it did save, but I'm not sure that I just saved that. The other possibility is to use CO2 laser. I'm a little bit hesitant. At first, I thought maybe it's not a bad idea, but to use the CO2 laser in fairly deep, very skinny settings, but not as skinny as the tattoo dislodging process. And this could also free up the scars, but we're introducing a lot of heat. With this, 1 second, I have to move all of these bars first of all. We're inducing a lot of heat in the superficial layers, and oops, I made a mistake.
Then I have to go back and click them all again.
Yeah, okay, all right. Let me, so the one on the right-hand side is the baseline, and the others are in sequence. So give me just a second. I just wanted to see the before photos also, and to see if they were.
He's so cute and so nice.
He looks.
Oh, he's happy?
Yeah, he's so happy. He's like, when can we do another one? I'm like, well, let's give it. That's why we took a little bit of a break, and then now he's back. He wants like more.
So he's noticing an improvement.
Yeah, he knows it.
I mean, between here and here, you saw some improvement on the lateral side, maybe on the left.
No, I see.
I'm not sure that I'm seeing it. Maybe a little. I'm not 100% sure if I'm happy, but here my concern is always that, remember when we're driving heat into the more superficial layers, and if they're reacting somehow in an unusual fashion, we can also, you know, maybe create more puckering. And I'm a little worried, and this is why I would really like to direct the treatment for this particular patient to the depth. Skip the middle layer, and then the surface is fine to treat because we're really only treating within the epidermis when we're using the Cool-Peel, and don't go so much really into this like upper dermal layer where we might be creating more puckering. I think we're going to revisit the upper dermal layer later once we can deflate some of those rolling scars here in this area. I'm just worried to backfire.
No, I understand.
I think this is very challenging, you know, because if you look at the scars themselves, you would think the settings that were chosen so far are the appropriate settings. I would have started exactly and also treated exactly with the same settings, right? But, you know, seeing the progression or maybe the somewhat stagnant progression, you know, allows us always to you know, reassess the situation, see, are we really doing right? What can we do better? And rethink what scenarios. Dana, do you have any input particularly to this patient? Is she still with us on the screen?
I'm here.
You are.
I'm here. Yes. So, well, no, I agree with what you just said. Like I would have treated, I have people with similar skin and similar acne scars that I've treated very successfully with those same exact settings. So, and I do think it looks worse. I hate to say it. Like, I mean, and again, I think that you might be right that the focus is a little bit out on that first thing, but even looking at, I mean, maybe there's a little improvement on this cheek here, but from the third, but anyway, my only thing would maybe be like add in like the nurture or at least the peptide bliss in between, maybe to help with the healing process and just like, you know, rejuvenating skin in between treatments. That's the only thing that I can think of that you could maybe switch up as well, besides what you said.
Mm-hmm. I agree. I think I ask all of my patients that I'm still currently treating with acne scars to use Peptide Bliss because I feel it's very, very important for the healing. I know it adds a little expense of $83, but I think it is very much worthwhile to apply, particularly in those first few days where the Peptide Bliss can really still penetrate very nicely into the skin. I mean, I don't know, maybe it's not really first few days. I think the most important is the Peptide Bliss that we apply right after the treatment. And I think he's getting that anyway, but Dana, you're right. I think it will help a little bit to overall set the scar in the right direction.
Dr. Ringfall, in whatever office we're in, Haverford, we typically with the Vivace use the Nurture instead of Peptide Bliss. Are you okay with that?
Yeah, that's fine. I don't really have any particular objections. I like the Peptide Bliss very much because it's a serum. So I feel like a serum penetrates so nicely after the treatment. I could be entirely wrong and maybe not penetrating any better than a cream formulation. Ultimately, you have these small openings in the skin that the fractionated radiofrequency or any CO2 has created. And the columns in the skin themselves, they will be able to absorb, whatever topical you put on. A liquid is probably a little easier than a cream formulation, but ultimately the skin is still very warm when we have just treated, and the warmth allows any of those channels to stay open, but it also allows the formulation to not necessarily stay exactly in cream phase, but make it easier to penetrate. So I don't know that exact measurements were ever studied to see how the absorption cream versus serum works, but I just like the Peptide Bliss because of the serum formulation and my skewed thinking, for which scientific backup.
I can bring it up to him again. I usually try to recommend the peptide because it's cheaper, especially for like younger people. But because he's been like healing well, I mean, I had to convince him somehow that he needs it because the last two he heals beautifully within like week as expected with like no track.
Yeah, good. I saw one time you brought him back in. I think probably just to take a look how he was healing, and you had kind of scheduled a microdermabrasion. I'm not even sure that you did one, but you scheduled him. I am going to show some acne scars that look somewhat similar to this one here, and I'm going to show progress for that. So hold on just a second.
Well, because I accidentally I ordered the mediums, ordered the mild, but they didn't mark them. They were just like nothing.
Do the acne scars show on your photographs or not show on the photographs?
It's not doing it much. Hi, it's Megan. I walked in. Much severe before on the left. They're just not really showing up that much. Great.
As much, but I'm going to show you the front photos in a second also, but you can recognize that he has these kind of atrophic scars, partially rolling scars. Here we see a little bit of erythema, but overall the scars have actually kind of really filled in. don't know if we can make it any better looking. This way you see here they still catch some shadow on the jawline. There are also more shadow catching scars here, a little bit improved already. We're gonna go to the left-hand side, maybe take a look at those photos. But he had a number of treatments and overall very much improvement. I think he had, one second. I think he had, oops, one of those. He had fractionated radio frequency. He had CO2 laser treatments. He had some PDL treatments before the scars of, or he was also on Accutane as a treatment before the scar treatment even took place, just so that his acne would come to a halt, because he obviously had some cystic acne that created these scars. I don't know if they're as showy. Maybe on this side they're a little bit showier.
It's cute.
He's an actor.
I was gonna say, it looks like Ken. I mean, good profile.
He looks like my ex-boyfriend.
Maybe he is.
I know, right?
But you see this kind of cluster of acne scars obviously has much less in general than the patient of Bau's who we just looked at. But overall looks very much improved in these photographs. You see there's still some depth to the scars, and I think from the front we even see it better. But there is overall improvement. He thinks about 90% improvement in his acne scars, and I mean clinically I'm going to have to say that's how I would probably judge it as well. So I think he had overall greater improvement than we would expect in general, but it's not like all of the acne scars are gone. He's just significantly improved in depth. I think on the front photographs, it shows even better the degree of how the scars have elevated from the depths that we see in here and also on the left-hand side.
Dr. Ringfeld, this is like a great example of like what I try to explain to people of our goal with acne scars is I say like, we're not, we're trying obviously to get rid of them, but the likelihood of them going away is not high, but our goal is to not make it be the first thing you see when you look in the mirror.
Right, exactly. And so I think overall in this particular patient, this is after, I want to say, 4 total fractionated radio frequency, 4 total CO2 laser treatment, and most recently I've now gone back to an approach. Hold on a second. Bravo? Can you move this there, please? Where we want to, we have gone back into the scars themselves, into like actual scars, very, very deep, just to kind of get a little bit of elevation in those still remaining atrophic scars. It's an approach that I had not actually done in a fairly long time, except for occasional patients. We used to do this before fractionated radio frequency became available, that we used the CO2 laser only into the deep scars in order to raise those scars up. But I think maybe this is something where in another 3 months I can show you hopefully even more improvement. He's very, very patient with his treatment, but it does take effort to create these scars. So again, other than the pulse dye laser treatment, he had a few of them when he still had some erythematous depressed macules when he came off Accutane. But other than that, he had now a total of about 9 treatments, and we're seeing results here after 8 treatments that are of the more significant type. This is not, a little project. It does take time. It does take push. It takes a committed patient. But I think overall the results, again, he's very happy. He thinks there's about an 80% improvement. Again, I have to agree, there is improvement. And I would probably say close to that is the right number. But I think it takes time, and it will pay off eventually. Any input here? Anything where somebody would like to share some ideas? No, yes, maybe.
No, it's great.
Okay. Yeah, again, it's just, I think maybe if we could make this particular set of photographs available, as Dana said, to show a before and after, you know, realistic expectation of what we can and what we might not be able to achieve. I think this would be maybe a good set of photographs to use. Do you guys ever use the iPads to show some of those before and after photos?
I have not.
No?
Yes, but I will.
I don't know who's agreed to allow their photos to be shown, so I never use it.
So the ones that Baruch had loaded for the physicians to show, these have all agreed for their photos to be shown.
I don't even know. I remember there being talks about it. I apologize I certainly don't remember. Where is that on the iPad?
And you're right, I never use it either. And so that's a problem, right? I cannot even instruct you. So we're going to ask Baruch to share with us where we can find that. I know we have to leave now, but, and he's on a phone call right now, so I can't make that available. So either I send the link in an email, or you know, or the like, or we'll discuss next week how we have access to those before and after photographs. But I think I'll ask him if he would agree to be on the internal site as a before and after, or I just amplify the cheeks so that we don't recognize the eyes or blind out the eyes or something like that. Yes? I mean, if we showed something like this, nobody would be recognizable, right?
Right.
Yeah, true.
And that shows good results. I mean, it shows, you know, the right results. Okay, we will make some photos available. Good.
Okay.
All right. Any last input, any last question, any last suggestion, comments?
Thank you for the envelope, doctor.
Okay. The Philly office has received some envelopes, but the rest of the office has not yet. It's only Philly. So Philly is a little spoiled in that sense.